Most people think red, itchy eyes are just allergies, and sometimes they are, but honestly, that's only part of the picture. If you look in a clinic to see what an optometrist sees over and over again, is people treating the symptoms, right? Here's this drop, here's that drop, go get this from the pharmacy, not understanding what's actually driving it. A number of times I've stood there in a pharmacy and seen somebody trying to buy an eye drop and just looking at the ingredients to figure out what might be the right drop for them. In the end, they picked out the one which has nafazoline. So you see, they don't really know what the issue is. I'm going to help you to look at things in a different light. I'm going to give you an idea of whether it's blepharitis, whether it's dry eyes. I'm going to help you to try and understand what it could be. And I get that it's frustrating. I've been on the other side of this because my son has had an issue with his eyes. It's been an inflammatory condition that just kept coming back. So what I've learned over time is that when your eyes are red and itchy, they're usually asking for help, and it's up to us to try and figure out what it is that they're asking for and what the best treatment is going to be. Right, it's not as simple as you think. So let's break it down properly. First thing to understand is your tear film. Now, I'm going to walk you through this really easily, and it's really important that you pay attention because most people think that tears are just water.
But they're not just water.
Your tear film has 3 layers, all right? So you've got water, you've got mucus, and you've got oil. Water, mucus, and oil. These 3 things put together form your tears. And when those 3 are balanced, your eyes actually feel comfortable. But when that balance is slightly off, the whole system starts to break down. And that's when you start to feel red, itching, burning, irritation. And now here's where it gets actually really interesting, because this is something a lot of people don't realize. Your eyes can be watering and they can still be dry. So what's actually happening then? How can they be watery and dry at the same time? The ratio is off. Remember that. The tears are missing either oil or mucus. So they evaporate too quickly, and that exposes the surface of the eye. And your brain goes, something's wrong here, right? So it triggers a reflex and floods your eye with this water. But that water doesn't stay, because it doesn't have the oil or the mucus to hold it in place. So it just spills over. And that's why people say, my eyes won't stop watering. So it still feels dry, but it's watery as well. I often explain it like concrete, right? Think about it like this, that if you've got the wrong mix, if you've made concrete and it's not the right texture, that concrete won't hold the thing in place. It's too watery, it'll be too runny. And that's the same thing with the tears. If there's too much water and not enough binding material, it doesn't hold. Tears are exactly the same, okay? Now, one of the biggest drives of this is your oil glands. You have oil glands on the lower eyelid and at the top, and they're called meibomian glands. Their job is to release oil, and that keeps your tears stable. But what happens is, especially with screens, you actually blink less. And when you blink less, those glands don't actually release properly. And over time, the oil can actually thicken, almost like honey or toothpaste sitting in the tube for too long. And that blocks the glands, right? And so it doesn't come out. So now your tear film becomes unstable and your eyes become reactive to what? The wind, to screens, to makeup, allergens, everything, especially cosmetics, eyeliners and mascaras. And this is why just using drops doesn't solve the problem. You need to look at things holistically, because you're adding water but not fixing the system. So let's talk about allergies as well for a second, because yes, allergies absolutely play a role. But something hits the eye, your body releases histamine. That's what's going to cause the itching. It's the histamine. The redness, the swelling contributes to all of that. But here's the thing as well. Allergies rarely act by themselves. If your tear film's already unstable, your eyes become far more sensitive, right? So now you've got dryness, plus you've got an inflammation, and they're feeding each other. And it's just a cycle. And this is where people get stuck. What do you do? How do you treat? Is it the chicken or the egg? They treat the allergy but not the dryness. Or they treat the dryness but ignore the inflammation. Now, another big one I see is blepharitis. Now, this is inflammation along the eyelids, usually linked to bacteria, believe it or not. Look, I have that. And I know this one absolutely personally, that overnight, while your eyes are closed, the bacteria builds up. By the time you wake up in the morning, that debris mixes into your tear film, and that's why a lot of people notice itchy eyes in the morning, right? And their eyes are a little bit red, the eyelids might look a little bit inflamed, and there's definitely crusting around the eyelashes. If we look with a microscope at patients who come in, we can see that very tiny amount of crustiness, which indicates to us that there's definitely some kind of blepharitis going on. I see that a lot in patients. Even in my own eyelashes, I thought I was fine until I had my colleague look and check it out for me, after which I started the process of cleaning my lashes. This is many years ago, and everything was fine. So you've just got to be on top of it. So you see, eyelid hygiene becomes extremely important. And here's something else people don't really think about. Your eyes are often worse in the morning because overnight you're not blinking, tear production drops, inflammation increases. And if you've got airflow like a fan, or you've got like a air conditioning unit, it can dry things out even more. So small changes at night can make a difference. So you've got to be very careful of what kind of environment you've got where you sleep. Now I want to touch on something a little bit deeper, because not all red eyes are simple. My son had a condition where the inflammation kept coming back. We went to the ophthalmologist, he had an inflamed area. You can see the redness, which was sectorial. It was just in a small area, and it just kept coming back, even though we'd given him FML, which is an anti-inflammatory, right? And it just wasn't working. And so what we had to do is, once that inflammation went, we realized that we had to give lubricants to support the eye afterwards. If we didn't, then it would return back. So the point is, healing doesn't stop when your eyes look better. You've got to keep going. You have to keep supporting the surface so it stays stable. Now, one last thing as well, kids, adults, we just don't blink enough. It's just the thing that's happened, especially over the past 30 years while devices have been on the increase, TV screens have become bigger, and we're watching more of it as well, Netflix, etc. It just makes us want to stare at it. Now, you see, a normal blink is every 3 to 4 seconds, but on screens, that drops significantly. So less blinking means less oil release, more evaporation, more dryness. So for kids, and even for adults, it's not just about screen time, it's about how we use screens, being proactive and understanding that the blink rate matters. So you have to remind yourself. Don't just look for a quick fix, which is eye drops. Take a step back and ask the simple question: what's not working right now? Is it the oil? Is it the tear balance? Is it the inflammation? Is it your habits? Because once you understand that, everything's going to change. You stop chasing the symptoms and you start fixing the actual cause. And that's where you're going to get better results. If you've enjoyed this and you want to know more, or if you have any questions, reach out to me. Please hit that like, subscribe, and follow, and we'll see you on the next one. Thanks so much.